So this is my carry-on medical supplies. Keep a knee brace just in case my knee goes out and I can not fall while I'm walking. It's always good in my opinion to do that, so I don't if I have a knee injury, because I was an old paratrooper and I got a bad back and bad knees. So to me that's important. My next items are some eye and ear drops. Nothing worse. Now if it's an ear or if it's an eye drop, you can use it in the ear. That's tobramycin. This is azithromycin eye drops. And of course, a steroid cream in case I get into something itchy. I have an extra cool blanket here for shock. Keep a couple of albuterol on hand. As far as for wound care, a couple of field dressings here, emergency bandages, 3 each. Some elastic bandages that can be used as a wrap for a joint or for a bleeding measures. I have this Dermabond here to close a wound. It's basically sterile super glue. You can never go wrong with some Curlex. Suck in a wound. This is a vented chest seal. It's for vented chest seals for a chest wound. If you develop a pneumothorax or a hemothorax. And this is a 14 gauge needle for needle decompression. Second intercostal space. Midclavicular, right down the clavicle. So these are some documentation that I keep, some field emergency documentation. Of course, you can't go wrong with some antibiotic ointment. I keep a skin stapler on hand, alcohol pads, some tape, this is a universal splint. You roll it up, splint the wound, and this is a cauterizer. If you have something that needs to stop bleeding and you're in trouble, you can cauterize it or try to. We call this moleskin. I know it doesn't look pretty, but if you get a blister on your foot and you still got to keep moving on, you can put the blister, get it treated like that, put that on there. Just in case, I keep some suture material, some stronger suture material, a tourniquet. I'm not real particular about the brand, as long as it does its job. And of course here I got some iodine swabs and some tincture, compound benzene tincture. Steri strip in case there's a small little wound, a little boo-boo, take care of it. And when I have back pain, I have some lidocaine patches that I keep on hand. And this is to stop bleeding, bleed stop. As far as medications are concerned, never do this, but I have an allergy pill, cetrizine here, some ibuprofen, and some Tylenol for pain. Keep some cotton tip applicators on hand just in case. And the specialty items I keep stored in this bag here. So I have some scissors and some hemostats in case I need to sew a wound up. Some Cobain dressing. And this is a nausea pill, Dancitron. If you're nauseous, you don't want to throw up and lose fluid. Some clean gloves. We've already talked about the steri strips. This is zithromycin, a Z-Pack. This is a disposable scalpel in case I need to open up something and drain it. For a burn, some burn relief gel. And then this item here, I keep it under safe. I'm going to open it up. As you can see, I keep it taped up a little bit. These are my meds that I keep in here. Doxycycline, which I'd use for pneumonia. Tindazole, antiparasitic. This is Septra, antibiotic. Of course, this is epinephrine, adrenaline, and various means to administer it. And I believe this is another zithromycin Z-Pack, which covers for bronchitis, skin infections. And of course I want to keep these items safe as possible, so I keep them stored in there. So that's my personal aid bag in a nutshell. There's a little redundancy, but if somebody else gets hurt, maybe I can help them a little bit without opening up my main aid bag. And of course I missed earlier some undergarments. It's good to have. I don't go otherwise. And of course, holy water, because you never know. And I did mention I got my little stick here. I carry that with me so I don't bend over. So those are my personal medical items. Or if somebody else needs help and I can help them, of course I'd help them. Thank you.